Assalamualaikum warahmatullahi wabarakatuh. My name is Virgiawan, and on this special occasion, I will present the result of my research. International Relations Student Perception COVID-19 Vaccine based on their political preference. So here is the outline my presentation. First, introduction. Second, a literature review. Third, research method. Fourth, result. Fifth, discussion and conclusion. COVID-19, which was first discovered in Wuhan, China, began to spread throughout the world, including Indonesia, with the first identifiable case announced by uh, President in March 2020 to prevent the spread of the virus. The government recommend a protective behavior such as physical distancing, hand hygiene, and use the mask. The increasing number of the infected cases prompted the government to issue a large-scale social distribution policy. Finally, months later, a vaccine to treat COVID-19 has been found. Then the president launched a vaccination program which is divided into four parts and has already started. The COVID-19 vaccine provided by the government has various options, and at the same time the media is highlighting this, which raises various public opinions. According to the Ministry of Health, vaccines are biological products containing antigens in the form of microorganisms or their parts or substances they produce which have been processed in such a way that they are safe, which, when given to a person, will actively produce specific immunity against certain disease. In other, in other words, the main function of vaccine is to provide immunity so that if one day they get sick, they will not get sick or only get likely sick. Nolan McCarthy states that political scientists often discuss polarization in terms of broader ideological difference among voters. Ideology can refer to a general orientation to politics and government. In the Indonesia, we often imagine that politics is polarization by ideological orientation between nationalist and religious groups. According to De Bruyne, Shaw, and Goldman on the political polarization on U.S. citizen perception of COVID-19 risk, police the preference and the protective behavior, suggesting that risk perception and the preference for COVID-19 risk mitigation in the United States may differ from political trends. Another study conducted by Conchubedani, Prince Wilshauser, Sharma, and Webb on COVID-19 vaccination dope in the United States, the vaccine adhesion is significantly predicted by several factors, one of which is political affiliation. While it is known that political tendencies influence the perception of risk as well as the action to be taken, little now about the effect of political reference of the COVID-19 vaccine. Therefore, this study aims to determine whether the perception of COVID-19 vaccine is accordance with political preference. Well, this in the research method. Since the research is quantitative study, data were collected through an online survey. The participants of the study were 31 students of international relations in the fifth semester. The survey was conducted online using Google Form and disseminated through WhatsApp and line groups. Then the data was analyzed using SPSS 26. So, what do you think about the vaccine and the vaccination for COVID-19? Based on The result of this study, uh, 92.2% of nationalists tend to agree that vaccines are the right solution to overcome COVID-19. Meanwhile, 66% of religious groups state otherwise. Well, the independent group had a high number of 90.9% agree. From this table, the majority of the three knew that the vaccine had side effects, where 92.2% of the nationalist group and 100% of the religious and 81.8% of the independent group said yes. Meanwhile, only under 20% of the three did know that the vaccine had side effects. However, there are differences of opinion among students regarding the implementation of the vaccination program. Uh, 84.6% of the nationalist group and 81.8% of the independent group support the vaccination program. Meanwhile, only 33.6% of the group religious group agree with the vaccination. Regarding the student willingness to be vaccinated, regardless of the side effect of the vaccine, about 76.9% of the nationalist group and 64.6% of the independent group start their willingness to be vaccinated. On the other hand, only 16.7% of religious group are willing to be vaccinated. Regarding the opinion of students whether the vaccine is able to reduce the number of positive cases, a total of the 76.9% nationalists are optimistic about this. Meanwhile, 100% of religious group who answered no indicated pessimism. In contrast, 63.6% of the independent group expressed their optimism about this, and 84.6% of the nationalists and 81.8% of the independent believe that the public's willingness to be vaccinated could affect the success of the vaccination program. Meanwhile, only 33.6% of the religious group believe it. Now, let us move on the discussion. This study showed that student perception of the COVID-19 vaccine are influenced by political preference. Nationalists view that the vaccine are the right solution, meanwhile religious group did not agree and independent group both agree and disagree. Nationalists and the independent group support vaccination and agree that success of vaccination depend on the will of the community. In fact, the majority of both express their willingness while religious groups tend to disagree. Uh, the independent group is optimistic that the vaccine will be able to reduce the number of positive cases, while the nationalist and religious group are pessimistic about this. However, they understand vaccine has side effects and are aware that they are risk of infection before being vaccinated. However, they do not believe that the vaccine will protect them for infection. The difference in the perception among the students so that political preference is an important factor that contributes to student perception of the COVID-19 vaccine. The results support research conducted by the Brunshaw and Goldman, who reported that political tendencies influence perception of COVID-19 risk mitigation. In their study, political tendencies lead to political polarization in the United States regarding perception of COVID-19 risk, police preference, and protective behavior. However, they did not report any vaccine-related polarization. Another study conducted by Considani at the start there are several factors, one of which was political affiliation, significantly prediction vaccine hesitation. This can be explained by the polarization socialist political climate and the individual COVID-19 risk perception. Thus, this polarization situation gives rise to device issues including the issue of vaccine dope. The study reversal the conclusion of the perception of the COVID-19 vaccine with political preference has been found. From the result of the analysis, it was found evidence of the influence of political preference on the student perception of the COVID-19 vaccine. The result conclude that the nationalists believe that vaccines are the right solution rather than the religious, while the independents are somewhere in the between. When it comes of vaccination, nationalists and the independent support more than religious group. Independents are more optimistic that the vaccine can reduce the number of positive cases compared to the nationalists and religious group. All three are also very aware to the side effect of vaccines and are aware of the risk of getting infected before being vaccinated, and they agree that vaccination does not necessarily prevent them from getting infected. The study showed positive results to determine student understanding and acceptance of the COVID-19 vaccine based on the political preference and the extent of political inequality on the COVID-19 issue. Based on the result of the study, it's recommended that actionable steps are needed to reduce political polarization. First, awareness of the case related to COVID-19 must be increased by community members, including educating themselves and others regarding this issue. Second, true and reliable information must be shared with community members to reduce partisan motivation excess. Lastly, political leadership that aim to unite not divide and embrace all people regardless of political affiliation is needed to combat COVID-19. That's all from my paper presentation. Thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.